Hello, Psychology. Today we're talking about the psychology of stress and health. And so in this chapter, we are going to look at the definition of stress first, and we will also take a look into the field of health psychology. When we talk about stress, essentially we are talking about physical, emotional, cognitive, behavioral responses to threatening or challenging events. Something that initiates the stress response, such as an exam, is a stressor. A stressor causes the stress reaction. Distress is the effect of undesirable stressors. From time to time, positive life events can actually cause the stress reaction as well. Eustress would be the effects of a positive event. So, for instance, Christmas, the holidays, are reported as one of the most stressful times of the year. Also, a wedding. Anything such as that would be very positive but very stressful. Catastrophic events can elicit the stress response. So this is the type of environmental stressor. So we look at the catastrophe. This is an unpredictable, large-scale event. Requires extreme adaptation, adjustment, feelings of threat, such as the falling of the Twin Towers in New York City on September 11th, 2001. But when we look at something such as a car accident that you might go through, this could be catastrophic for you. One possible response would be acute stress disorder. This is anxiety, nightmares, poor sleep, reliving the event, and concentration problems. A post-traumatic stress disorder is the same symptomology as acute stress disorder, except it's longer than 30 days. Someone might have post-traumatic stress disorder for 3 years, whereas acute stress disorder does not last as long. So health psychologists can also look not just at large-scale catastrophes, but what about major life changes? This is the social readjustment rating scale by Holmes. This is also something that we should look at because it's not always a large catastrophe. It could be major life changes. Look at life change units here. The death of a spouse, the divorce or death of close family member, marriage, dismissal from work, death of close friend, foreclosure or mortgage of a loan, beginning or ending school, change in life conditions, small mortgage or loan, Christmas, minor violations of the law. So if you were to add up all of the social readjustment that you have been through, there's a similar social readjustment rating scale that was adapted for undergraduates. Now, this is also mixed in it with things I would label as catastrophic, but sexual assault, if you gave that 100 college undergraduate stress scale, CUS, so 100 points for not just sexual assault. What about finding out that you are HIV positive? Concerns about being pregnant, finals week, having significant other cheat on you, financial difficulties, 2 exams in 1 day, getting married, difficulties with a roommate, maintaining a steady dating relationship, getting straight A's, fraternity or sorority rush, and falling asleep in class. Each of these, this is adapted from Renner and Mackin in 1998. So I challenge students to simply tally up their CUS score and their SRRS score to get some idea of the social readjustment and stress that you've been under. What if we just added another 75 points to fears of being COVID positive, or quarantining for 10 to 14 days, fears of a family member becoming ill, all of those sort of COVID-19 related stressors, I think, could easily garner 75 to 100 points. Hassles. Sometimes we're not discussing the catastrophe. Other times we're not discussing social readjustment, but we could be just mentioning hassles. Now, hassles are the everyday frustration, delay, irritation, and minor disagreements that we face in life. These are residual ripples from minor stressors, but they can have compounding effects. It's not that big of a deal if you wake up late, but if you wake up late and you can't find clean clothes and you can't find your keys and your wallet, and once you get in the car, then you realize you're on empty and you have to drive 25 minutes to school and you only have 30 minutes. Plus you have to get gas. And you find yourself speeding, and then you're rushing to get to class on time, and then you realize that the teacher has canceled class and only put a note on the door and is not giving you a notice through your Canvas learning management system. This is stressful. Pressure comes from demands or expectations from an outside source. A boss lets you know that you need to come in and cover someone's shift. Or you have a test or a midterm or a paper where you're having internet problems and you can't access your work. Or your family tells you that you're expecting a child, that your family's expecting a little brother or little sister, and it's definitely going to impact your life. Frustration could entail getting pulled over by the police. You have perhaps a desired goal or fulfillment of a perceived need being blocked. Now, other everyday sources of stress could be aggression. So when there are actions that are meant to harm or destroy that stem from frustration, for instance, displaced aggression. If a parent is stressed out because of work-related problems and they come home and bring this stress to bear on their families. Another stress management technique is withdrawal, isolation or withdrawal. And the ultimate form of withdrawal in America is suicide. From 1980 to 1996, this is roughly the first 20 years of my life, the suicide rate of 10 to 14-year-old kids doubled. In 2004, this was the third leading cause of death for adolescents. Rates increase with age, and men are 4 times as likely to complete suicide attempts as compared to women. Now, women have a higher attempt rate, so they're attempting suicide more commonly than men, but men are completing suicide at a higher rate. Men are oftentimes using more lethal means. American Indians and Alaska Natives have a high suicide mortality rate. What would happen if you have a friend that expresses suicidal ideation? Well, to know the warning signs of someone who's battling this, the warning signs are similar to that of depression. So people who are suffering from a major depression are at a higher risk of suicide. They would express feelings of emptiness, lack of energy, inability to feel pleasure, irritability or sleeping problems, eating more or less than usual. Preventing suicide is sometimes as simple as reaching out to this friend, letting them talk, asking them if they have thoughts of suicide, staying with them. If you have immediate concerns, if you fear that someone is of acute suicidal risk, then it would be imperative that you call the police. Perhaps the friend is not expressing having a means and a plan of suicide. Perhaps they just have a desire for the problem to end. If they are making suicidal gestures, such as self-injury or locating some means of suicide, developing a plan, then you would, I think a good place to start if this friend is in high school living with their parents is to let their parents know if they won't get help with the suicide talk hotline. Even the school counselor is a good place to start if you do not feel that going to the parents would be beneficial. Conflict is another stressor. A conflict could be a pull toward two desired goals. This would be an approach. An avoidance. You must choose between two undesirable goals, rock and a hard place. You may not want to leave town. There may not be a college in your town that you'd want to go to, so it would be either leave town or go to work. And both of those may not be desired outcomes. Approach avoidance. Only one goal you must choose or not choose the goal with both positive and negative consequences. So each of those conflicts can be stress-inducing. Next, we talk about the sympathetic nervous system, oftentimes referred to as fight or flight. When you encounter a stressor, a situation that you fear that you can't escape, it would be dreaded speech class. You stand up in front of the class to give that speech and you find your heartbeat is racing, your mouth becomes dry because you get nervous, your pupils are dilated, your tear glands are inhibited, even your digestive function and the functioning of your pancreas and intestines is constricted. Your bladder can sometimes be constricted as well. So just all of the systems of your physiology get locked up when it comes to a situation that makes you nervous. And this is likely because you're not getting the oxygenated blood flow that you need. The reason why you're not getting the oxygenated blood flow is because heartbeat is pumping and your lungs are dilated. When we are relaxed, then we encounter the parasympathetic nervous system. Our bodies slow down. Our heartbeat is pumping good blood and our lungs can grab those red blood cells and carry blood throughout. The heart is pumping blood throughout our bodies. This causes our saliva glands to basically regulate. Our pupils are constricting, digestive functions become regulated as well as our bladder. So really the key to everything in relaxation is breathing deeply. If you've taken my class on ground, I have likely led you into time of relaxation where you're simply bringing air into your belly, your diaphragms is diaphragmatic breathing, carrying it to the top of your lungs, holding it there, and then exhaling. Just a slow breath, usually 3-second inhale, holding on to this for 3 seconds. And you can feel the top of your lungs expand and then just exhaling very slowly. And research shows that intentional relaxation can lower blood pressure, lower heart disease, hypertension. It's usually involved in the treatment of anxiety and stress-related disorders. If you look at the general adaptation syndrome, you can see the body's resistance to stress. When you go through shock, such as a firefighter gets a call, they put on their turnout gear, they run and get on the fire engine, they fight fire, and they are really at war with that fire. Let's see the normal level of resistance right about here. But when you are in extreme alarm phase, then your body is depleting itself of resources. After you're done with a fight and you rest, you see exhaustion, and your body then crashes. The problem with people encountering extreme stressors, and they endure these for a long period of time, your body was not meant to go to war and stay at war for years. People in an abusive relationship, children who are abused, soldiers, really endure life stressors in months. And health psychologists can look specifically immunologists. These are individuals who study the immune system. Individuals who go through a stressor for 2 years, such as a deployment overseas where they are engaging with enemies, as compared to individuals who have no stressor. Those people are 4 times likely simply to come down with a common cold. There's also certain personality traits, certain unhealthy behaviors that lend itself to heart disease. When you look at catastrophes, major life events, hassles, and a personality type that's often referred to as the cardiac personality. Type A personality is very competitive. They are sometimes so competitive, they may even be combative. They thrive on stress. When you compare these with unhealthy behaviors such as alcohol use, a poor diet, then they may have severe coronary heart disease and long-term consequences. So when we look at stress and the immune system, you guys know that the immune system refers to cells, organs, and chemicals that respond to disease, infection, and injury. These are negatively affected by stress. So psychoneuroimmunology is the study of psychological factors and the impact they have on the immune system. So we have a natural killer cell. This suppresses viruses and destroys tumor cells. The problem is that stress negatively impacts your immune system. When you look at the effect of personality on stress, the cardiac personality, or the type A personality, is ambitious, time-conscious, hardworking, possibly even hostile. A type B personality is relaxed, less competitive, and slow to anger. The type C personality is pleasant, repress their anger, so they internalize their anger and anxiety. It may manifest itself in terms of headaches or some other kind of stress-related issue. When you compare type A to type B, men with coronary heart disease as compared to healthy men, there are basically 3 men with coronary heart disease who are type A as compared to 1 that is healthy. So far more type A men have coronary heart disease than do not. Likewise, there are more type B men who have a healthy report from their doctor than those with coronary heart disease. Now, striking that balance is the hardy personality. This is a person who thrives on stress, but they lack the anger and hostility of type A. They have the 3 C's: commitment, control, and challenge. Because we do need a certain amount of stress in our life. Those use stressors, use stress or stress from positive events. That's the challenge in life that we need. Optimistic people are those who have a positive outcome towards life. Pessimists are those with negative outcomes, like the power walkers here by the beach. The way to increase your optimism is to simply stop and think, recognizing negative statements and simply correcting those. We do have to look at sociocultural factors and their relationship with stress. So social factors include poverty, job-related stress, workplace-related stress, and acculturative stress. So entering a majority culture that is different from your culture of origin is what we call acculturative stress. In time, stress can lead to burnout. These are negative changes in thoughts, emotions, behaviors due to prolonged stress. And we may need to adapt to a dominant culture, and you have 4 methods of acculturation. Integrating into the culture. Integration is simply, your physical body is in the new culture and you're making changes, possibly learning the language. Assimilation is when the new culture is inside of you, when you really start to identify with the new dominant culture. Separation is when you are not assimilated and you don't have anybody with you. So if you are in another country and there are nobody that speaks your language, nobody who likes your food, nobody who likes your favorite sports team, you will feel separated. Now, marginalization happens when you are in a minority position within a culture, but you don't have a group of people to identify with. That's separation. Marginalization, you can have a community within a community. As long as you have a strong social support system, a network of family and friends and neighbors, you're in a much better shape. So in coping with stress, the idea here is mastering, not just tolerating. You can look at reducing stress effects. So all of those things might be an option. Here you have a dad fighting with making a birthday cake, and he's ready just to destroy the birthday cake. Now you have problem-focused coping, which seems to try to eliminate or reduce the source of stress. But emotion-focused coping is that when you're trying to change yourself, you're not necessarily trying to change the environment, or there may be things you can't change about the environment, so you're trying to do some work within your own perspective. Sigmund Freud talked about defense mechanisms. He said these were unconscious distortions of perception to reduce anxiety. He often referred to these as ego defense mechanisms. You're probably familiar with denial. This is refusing to acknowledge threatening situations. If you are failing tests and getting zeros on work, but you refuse to acknowledge that the teacher is going to fail you because you think the teacher's nice and they'll really cut you a break, then you could just simply be living in denial. Repression. This Freudian concept says that it's a refusal to acknowledge a real threatening event that happened. It is living as if the event did not happen. Rationalization. This is inventing acceptable excuses for unacceptable behavior. Projection. This is when unacceptable impulses are seen as originating in someone else. This is when your mother tells you that when you point the finger at someone else, you have 4 fingers pointing back at yourself. Reaction formation. This is the opposite emotional or behavioral reaction to the way one really feels. This is going to hug your frenemy, the person that you secretly have great animosity towards. Displacement. This is redirecting feelings from a threatening target to a less threatening one. Displaced aggression, as we've already mentioned, is simply acting out your frustration on your children. Regression is falling back on childlike responses under stress. Children who have already been potty trained and who are really in school, they've stopped smoking, sucking their thumb. If they start sucking their thumb again and they start wetting themselves, this is regressing back to more childlike responses. Identification is trying to become like someone to deal with anxiety. And Freud said this really happened as a process of identification with one's same-sex parent, becoming like your father, even though you had some issues with your dad, you tried to become like him. For girls, he said this happens when they started to identify with their mother and play along and starting to manage that anxiety. Compensation is making up for inferiorities in one area by becoming superior in another. And sublimation. This is channeling socially unacceptable impulses into socially acceptable behavior. Perhaps when you were a child, you were trying to learn t-ball or learning to hit a baseball with a bat. You heard someone say this: just pretend that the ball is the face of someone that you hate. Because we don't teach children to take a baseball bat to hit their enemy over the head with it. Instead, we simply say, pretend that the ball is your enemy. Well, this is actually sublimation, and Freud would have a field day with this. We channel socially unacceptable impulses into socially acceptable behavior. So, coping strategies. Meditation is a mental exercise to refocus attention, a trance-like consciousness. But research has also basically likened meditation or linked meditation and prayer. People who spend 20 minutes a day praying and people who spend 20 minutes a day meditating look very similar in terms of their physiology, some of the same physiological things happening. And what would separate the two is this kind of mental imagery. Meditation, and many of the Eastern religions are using meditation that is visual in nature. So guided imagery would be the psychological adaptation of Eastern religions. So you'll have therapists that lead their clients in guided imagery. And it could be something like this, right? They're taking real deep diaphragmatic breaths, and the client and the therapist both have their eyes closed, and the therapist is asking the client to visualize, right, breathing in this clean, refreshing air and exhaling this dark, cloudy, brown smoke, right? And that represents stress. And over a 20-minute period of relaxation and guided imagery, then the therapist will tell the client simply to visualize that with every exhale, the smoke gets clearer. And so by the end of the 20 minutes, right, you don't have any more stress and you are exhaling. So when you have relaxation that is tied in with guided imagery, it's basically meditation. It's very similar to Eastern religion. So you have concentrative meditations focusing the mind on repetitive or unchanging stimulus to clear the mind or relax. You also have receptive meditation, just becoming aware of everything in the immediate consciousness. You hear another word for this is mindfulness, right? Be mindful. You're talking about in psychotherapy, if you're talking about a relationship issue and you find your muscles getting tense, and you find muscles in your face getting tense, and then the therapist will direct the client to be mindful of how that thoughts of that relationship are being carried in the body. Perhaps some clients see this as a little too mystical, maybe too quasi-religious or too Eastern. So for Christians in the West, perhaps I have known clients who would pick a portion of a sacred text of scripture and simply say this over and over in their mind while they're taking the deep diaphragmatic breaths and practicing the progressive muscle relaxation, which is, this is basically what yoga is doing. If people are participating in yoga and, one pose or one sort of stretching motion where you're stretching your forearms and you're taking deep breaths, what this is doing is that it is causing oxygenated blood to rush into your muscles. And the reason why I think yoga is taking off so rapidly in America is that it's really capturing a lot of things that science has proven to be effective, intentionally, not like entering a space where you're not going to think about whatever's stressing you out. The breathing is physiologically, scientifically proven to be effective. And then focusing your attention on something that you think is important. Now, just in America now, we have blends of lots of different, you could say it's sort of a cultural leveling, of different cultures. Individuals who attend one religious service a week have lower stress levels. Actually, they have a longer life expectancy. Now here you have in the background people participating in the Day of the Dead, which is practiced in Oaxaca, Mexico. Here's something that is perceived to be as grievous, the death of loved ones. They believe that on a certain day, that the spirits of the deceased come back and visit them. So their kids will dress up like skeletons and ghosts, and the adults drink alcohol and they pour out libations, pour out alcoholic beverages at the grave sites. And that might seem kind of shocking to some of us from a Western kind of Judeo-Christian influence. But if you look at just religiosity in general, those who attend religious services a week have longer life expectancy. But also some things that increase happiness, overall happiness, not just religious attendance, exercise. So for instance, healthy habits, eating well, exercise, laughter, talking about the things that stress you, some kind of relaxation strategy. 20 minutes a day has been proven to lower blood pressure, to lower risk of heart disease, to manage stress levels. So exercise, social activities, getting enough rest, eating healthy foods, having fun, managing one's time, practicing good coping skills. And the one thing that I will say about religiosity that social scientists really can't get away from is the sense of community that it oftentimes produces. So it's yes, it is perhaps going to a religious service, but it's also a sense of social solidarity, community, and there is an optimism that is oftentimes built into it. So, right, this event has purpose. This terrible tragedy is purpose in my life. Believing in a purpose, that your life is meant for something purposeful, is oftentimes used in wellness. It's used in therapy. Another component of religiosity that I haven't seen it in the book, I haven't seen it much in the book, but forgiveness, resolving bitterness and anger and those kind of things, those negative emotions, resolving those, getting to a place of peace and acceptance. Those things do have very proven physiological benefits. So I'm going to ask you guys in the discussion board to talk about positive versus negative coping strategies. I'll probably also ask you to talk some about what would you do if a friend started discussing suicidal ideation. All right, good job. Look forward to hearing from you all in the discussion board. Take care.